What's great about the VA system is that we're able to offer such a broad continuum of mental health and substance use services all within our umbrella. So we have everything from mental health that's embedded in primary care, and that's the best place for people to start. They can be seen for a couple sessions if that's all they need, or they can then get a referral to another program. We have a general mental health program that provides medication management, individual, group, and couples therapy. We also have a number of specialty clinics specifically for military PTSD. That's either for combat trauma or military sexual trauma or any other kind of trauma that was within the military. We are also able to provide trauma therapy for veterans who are eligible for VA care. If trauma happened at any other point in their lifespan, it would just be through that general mental health clinic. We have services for substance use disorder. We have services for serious mental illness, including bipolar disorder and any type of psychosis. We have residential programs. We have inpatient programs. So it's really that full continuum. And we have peer support providers who are veterans who are in their own mental health or substance use recovery, and they're embedded in each one of those programs along the way to really help the veteran feel like they have somewhere there who's been through what they've been through and can help them navigate the system and connect with each of these programs as they're needed.
Do they usually ask for help, or does it involve someone asking for help on their behalf?
It's different in every case, right? And we try to make, at the VA, we try to make any avenue that anyone is reaching out for help a way for them to get connected. And so the main avenue is for veterans to go through their primary care provider, and they can have a warm handoff, usually that same day, with a mental health provider who's embedded in that clinic. But also sometimes it's family members, and we have that coaching into care line that the VA has, where they can help family members figure out, how do I broach this topic? If the veteran isn't quite ready to get help, but the family is really concerned and wanting to kind of encourage that. They also provide resources for family members to do that. Sometimes it's another community member or someone else who's concerned, who can kind of help connect the veteran to our services. So we try to get the word out to as many people as possible and do as much veteran to veteran outreach also, because we know that the places that veterans have mental health concerns are usually not in our office. It's usually in their church, in their neighborhood, with their friends and family members. So we try to get the word out as much as possible about all these services, so that wherever the veteran is having a concern, they're able to get access to someone who can connect them with services.
Generally speaking, I know that several law enforcement agencies do have their own mental health professionals, but is the VA also ready to help them as well with whatever situations they encounter?
Sure, we have a workplace violence prevention coordinator who works really closely with law enforcement locally, and they have a great collaborative partnership.
And finally, why is it so important for them to get the help they need?
My job at the VA is to promote veteran mental health and substance use recovery, and to get the message out that recovery is possible, and that with the right support, which we offer here at the VA, as well as a lot of other places in the community in partnership, veterans can get past a crisis. Veterans can get past this difficult time, or learn how to cope with their illness, and really go on to live a full, productive life. That recovery is possible, even from these more severe mental health concerns, psychosis and bipolar disorder and things like that. We have really effective treatments. And if we're able to get the word out about that there is hope, that there is help, I think all of our communities will benefit from that, not only our veterans and their families.
Thank you so much. We really appreciate that. Anything else you'd like to add?
Just the main avenues, getting the word out again, that the main avenues for accessing mental health services are through VA primary care. And we also have an option for veterans to send a secure message through My Healthy Vet to the mental health outreach team. And so that's not for emergency services. You know, that should go through our emergency department and the Veterans Crisis Line. But for if you're just needing to get connected to routine mental health services, you can message that mental health outreach team in secure messaging through My Healthy Vet. And then we also have same day access at clinics where veterans with a need for mental health services, again, where it falls in between that emergency and waiting till my next appointment, they can come to VA and mental health and primary care clinics, and we'll be able to be with someone to figure out how to get that need met.